If we're to understand the anatomy of the congenitally malformed heart or the normal heart, the first thing we have to do is to describe it in a uniform fashion. Now, I'm showing you the heart at the moment as it lies within the body. Obviously, for the most part, when you're doing surgical procedures, you tend to view the heart as it lies in this situation, so that the superior caval vein is to your left hand, the inferior caval vein is to your right hand. But when we describe the heart, we should still describe it using terminology that reflects what we call the attitudinally appropriate position, which, as I'm showing you now, is the way the heart lies within the body, so that its apex is pointing to the left, and in most situations the heart lies such that 1/3 of its bulk is to the right of the midline and 2/3 of its bulk is to the left of the midline. Sadly, however, for years cardiac anatomists have described the heart in this fashion, as though positioned on its apex. And only then do we see the four-chambered arrangement, so that the right atrium is above the right ventricle, the left atrium is above the left ventricle. But this gives us problems, because it's only when we describe the heart in this apical or Valentine fashion that this vessel can truly be considered the posterior descending coronary artery. In fact, if I rotate the heart back and I put it back into the position that it lies within the body, then you see that this artery in reality is positioned inferiorly. And surprise, surprise, when you have blockage of this artery, it produces inferior myocardial infarction. So I believe it makes far more sense to describe the heart and the structures within it as it lies within the body. We have another problem if we consider the papillary muscles supporting the mitral valve. I'm showing you now the heart as it would lie within the body. And this is the anterior surface of the heart. This is obviously the posterior surface of the heart. And now, if we look at the location of these two papillary muscles, we see that relative to the bodily coordinates, this muscle, positioned inferiorly and closest, as you see, to the septum, is anterior to its superior counterpart. Yet paradoxically, currently, we describe this muscle as being posteromedial. And that makes no sense at all. So I believe we should be describing these structures as they lie relative to the bodily coordinates. So this should be the inferior, the septal papillary muscle, this one, the superior and the lateral papillary muscle. So throughout the presentations I'm going to make for you over the next few days, I'm going to try to describe the heart as far as possible as it lies within the body, attitudinally appropriate descriptions.